Listen every weekday afternoon during the KSJE Evening News at 5:30. Good morning, everybody. I'm Scott Nicklin with KSJE, along with
Megan Cullip.
Here we are again.
It's great to be here.
Happy Thursday.
Happy Thursday.
We are here for the local community information program about COVID-19 to share with our community, and we are back live. So,
yeah,
go technology.
Go technology.
Thank you.
Love me
YouTube,
a live
Facebook,
show.
everybody.
Yes.
So, thank you very much. Again, if you have a question, you can write it on our Facebook page. On the live stream video, we will see it here. You can also call us at 566-3909, since everything is working today so far.
Right.
And so
go big tech.
We will do that.
Yes.
But we're going to start with a guest this morning.
Yeah, how exciting is that? It's like doctor's show today, right?
It's going to be the doctor's show.
Yeah,
That's right.
cool.
Healthcare professionals, and we're so thrilled to have folks calling in to join us with the latest information about what's going on. We're going to start with Dr. Andreas Gensini from Presbyterian Medical Services. He is their Vice President of Clinical Affairs. And Dr. Gensini, can you hear me all right?
I can hear you. Good morning.
Good morning. Thank you for joining us. And now I know, of course, and I always tell listeners I'm on the board of Presbyterian Medical Services and proud to serve on the board. So I know a lot of things that are going on, but I don't know as much as Dr. Gensini. That is for sure.
That's probably for sure, Scott.
Yeah, you didn't need me to say that, did
Nope.
you? No. Anyway, but doctor, give us an idea of how things are going with PMS, because you have medical clinics throughout our state and are still dealing with folks who are just showing up, not maybe with this, but are just sick.
Absolutely. So, yeah, thank you, Scott, and good morning, everyone. So, you're right. We have over 60 clinics across the entire state. We are a federally qualified health center, so we provide services on all lines of service, primary care, behavioral health services, psychiatric services, dental services, throughout, our communities. And, yeah, it's been interesting times, but, we've done all the work needed to get everything up and running, and we are seeing patients. We are interesting times. We've changed most of our visits to telephonic visits, which is a good resource during these social distancing times. But at the same time, we are also open in all of our clinics, and we are seeing patients face to face that require that type of visit. So yeah, we're open. We are hoping everybody is aware that we are taking telephonic visits and that we are up and ready to care for our communities.
Good to know, Doctor.
Yeah, Dr. Gensini. So there's been concern, I know, around, we've just heard a story on PRI about it, about confidentiality and teledoc sessions. So do you guys use a special service that is not like a Zoom or something, but a special service that's created for physicians and other sort of HIPAA-related professions?
Extra security is what you're talking about?
Extra security.
Right, yeah. Got it.
So currently, during an emergency period, a lot of these restrictions have been lifted. However, throughout Presbyterian Medical Services, we've done, especially in our psychiatric side, telehealth visits, which require video and audio, and those ones are on HIPAA-protected platforms. Zoom is also one of the ones that it's HIPAA protected. However, we are currently just doing telephonic audio visits, and that basically, we have to have the patient's verbal consent to do this. And it's secured, but like you said, during these times, a lot of those restrictions have been lifted, which in status of emergency, we want to reach out to our patients, make sure they're doing okay and they're being taken care of. But yeah, it should be okay for now.
Very good.
Great.
And Dr. Gensini, I know, again, during all this, folks are still getting just sick, not maybe sick with this, but sick with the flu. Flu season is still with us, and or just showing up for appointments. I mean, that work continues, does it not, at your clinics?
Yeah, this work continues. This is kind of the timing that we have other seasonal conditions, like you mentioned. We have the flu, we have RSV in kids, and they are, this is a virus, so it has the symptoms overlap. And like I said, there are patients that will need to be seen face-to-face. Some of these conditions can be taken care of over a telephonic visit. We do have screenings in place in our facilities that if you're having symptoms that could be related to a COVID-19 or anything similar, we will offer a specific type of guidance to the patients, whether that is a telephone visit or, if we need to lay eyes on you and care for you, we will as well. So they are protective measures we take in our site and to keep everybody safe. We do ask patients to come in at specific times if they are having symptoms. We do have them call ahead in case so that way we can get ready for them and room them as fast as we can and take care of them. So there are systems in place. I think the best message is take advantage of the telephonic visits. However, if you need to be seen or your clinician deems that you need to be seen in our facilities, that is okay. We will take care of you.
Good to know.
Good to know. So I have a sort of broader question when it comes to, we every day at KSJE are watching these cases increase, and there's a lot of reasons for that, I'm sure, and we're still watching the curve and all of that. But something like the flu that has been kept track of for a long time, there's a lot more knowledge and information on it. Has social distancing impacted the flu? Do we have less flu cases because people are social distancing? And can that help us think about COVID-19 more positively, too?
So that is a very interesting question. I kept reading, my life has changed a lot lately.
Right.
And right. A lot of everybody's life for sure has changed, I made a comment to the AFP. Basically, all the reading I'm doing should count for the next 5 years of CME. So, but you're right. I mean, the social distancing, the hand washing, the staying home if you're sick, the proper cough and sneezing etiquette will affect the transmission of other conditions like the influenza, the flu virus. That is going to happen. I've seen and I've read reports that in hospitals, other conditions that are related to touching surfaces and touching your hands and touching your face and stuff like that have actually reduced infections across hospitals as well. So there is a lot that a simple hand washing, for 20 seconds, making sure you're covering all of that aspect is what it's really needed. Not only, like I said, social distancing, but just having those precautions that have been in place for a long time are proving now that, this is what we need to do all the time. And it's interesting. I don't know if you've done this exercise, but now that we're meeting through Zooms and having this social distancing, it is hard to not be touching your face. It's something that it comes to us kind of naturally. So people are more now conscious about it. People are now hand washing more. People are now, utilizing their hand sanitizers, which soap and water works just as fine and better. So yeah, it's interesting because we're not seeing that many flu cases in the clinic, that's for sure.
Interesting.
Yeah.
So I guess it's working.
Well, yeah, that's
regard.
my question is like, can we, use stats from other similar illnesses to feel more positive about this one? Because just yesterday, we were asking the docs over at San Juan Regional about, hey, we're not seeing the curve flatten yet. How long can we convince ourselves and each other to physical distance if we're just seeing it increase every day? So anyway, yeah, it was just a lingering question I had. And I figured, yes, like you said, all of your extra continuing education moments that you've been giving
Right.
during this time, you might have come across some interesting stuff. So thank you.
Very true. Very interesting. And we'll be asking those docs that same question later on today.
A similar question, yep.
Exactly. So, Dr. Gensini, in your medical career, again, do you have any ideas on when we'll see the end of this? I mean, we're getting a lot of information from the federal government, of course, and local officials, as Megan mentioned. We are all working to flatten the curve. We're all trying to stay home and social distance and physical distance ourselves. Are you watching these numbers, and where do you think we are as a state in New Mexico? Are we achieving our goals, or is there more work to do?
So I think, we've been watching the numbers. We all have seen probably those curves, and there's terms that now the general public knows, right? PPE with our personal protective equipment and flatten the curve. What does that mean? So currently, when we started all of this, the infection rate in New Mexico was every 2 days we were doubling the cases. Now we got to a point where we're kind of doubling every 3.2 days. And that is great because social distancing is helping do that. Washing your hands is helping do that. Staying home if you're sick is helping do that. But we need to do more. We need to do better. We need to ensure that we are staying at home. We are social distancing. If you have to go to the grocery store, don't go with your entire family. Just have one person go out. So it's all of these actions that we really need to focus on, and it does work. But we need to be conscious that we need to do it. I know it's hard, being 2-3 weeks in your home, trying to, if you have kids at home, schools are not, they declare the schools are closed until the next year, and there is a lot we need to do, and it's a new normal now, right? So everything has changed drastically from, we were recently wishing everybody Happy New Year, and we were, when should we stop saying Happy New Year? And now all of this is already kind of hit. So it's definitely something we can all do, but we're all in this together. We have to make sure that if you're non-essential, you stay home, limit the amount of exposure to everybody, and keep doing the measures. And I think, we go by the data that we have currently from the New Mexico Department of Health, the CDC. They are expecting that we will peak around May 2nd. And we can all put our little effort into making sure that is not May 2nd, and it could be sooner if we can all continue following the guidelines.
Right. I mean, that's a month from now. Not to be Debbie Downer, but it is. So
it's an exact month from now, Scott.
Exactly. So that's interesting that's the projection at the moment. But again, it could it's fluid, and things are changing day by day, hour by hour. So.
Well, and it sounds like we actually have a pretty good locus of control, we would say, like sort of in the clinical world, meaning that, we can do something which should be more, we should focus on that as more empowering than this invisible, deep, dark threat that is scary, but we can focus on what Dr. Gensini is saying. Yeah.
We hope the message is getting out to stay home, and and that could help flatten this curve.
I don't know how it could not be getting out at this point, but yes.
I know.
Yes.
But people are paying attention to it.
Yes, thank God, yeah.
And Doctor, just a couple final questions here. I know your time is very valuable. We appreciate you being with us. For all your folks that are working in the clinic, you mentioned that personal protective equipment. Do you all have all the things that you need at the clinics across New Mexico to deal with your patients? Or are you seeing shortages in your supply chains and things like that? And how are you making sure your staff is safe?
Yeah. So that's a great question, Scott. We do have. Early on, we implemented several actions across our clinics to ensure we could preserve and conserve the most PPE we can. Like all of the clinics around the nation and the world, we are experiencing shortages. We are having some measures to counteract that. We have been in contact with the New Mexico Department of Health, with our partners across the state, and currently we are stable, but like you said, things change throughout the days now. Everything we have to adapt day to day. But currently we are doing okay. I guess the main concern is not just during this period, but after this is calm and this is better, all of that work supply, people making stuff and everything is going to cause a little bit more difficulty to get some, but currently we're doing good. We're not in a critical stage, but that has come with a lot of work, a lot of partnerships, a lot of conversations, and ensuring that everybody gets the PPE they need. We do have a project that if somebody needs somewhere in our clinics, we are, sending them PPE and making sure that we are counting our burn rate and having weekly inventories. I mean, there's a lot of steps we have taken into ensuring people are safe. Not only patients, but our staff is taken care of as well. So we're doing okay for now. And like I said, things change throughout the time, and we're doing everything we can to preserve that PPE.
Very good. Well, Dr. Gensini, I appreciate you taking the time to be with us today with our listeners and viewers and sharing this information. Very helpful. And we want you all to stay safe so you can keep us safe and well. So thank you very much.
Absolutely. And thank you, everybody. To all your listeners, logging into our webpage, www.pmsnm.org. Check your clinic around your community. Call them, make your telephonic visit. We're here to help you and keep our communities healthy.
Well, we appreciate it, and please extend our thanks to all your staff. Dr. Gensini, thank you.
Absolutely, and thank you guys for helping us disseminate the word and for keeping us also informed during these tough times.
You're very welcome. We'll check back with you again. Thank you, Dr. Gensini, Vice President of Clinical Affairs, Presbyterian Medical Services, our guest here on KSJE. I'm Scott Micklin, along with Megan Cullop, and we are doing our local information program.
It is, I've been using this phrase, nerdvana.
All right.
So anytime we get to talk to the docs, it's like nerdvana for me.
You like that?
Over here. Oh, I love it.
Okay.
I've always been a science geek, so.
Have you?
Yeah.
Okay.
Yeah.
Nice.
Is this surprising?
No.
Okay.
No, because I've met you. So there you go.
There you go.
Everybody.
Cool.
So if you have a question, you can certainly write it on our Facebook page. We got a good morning earlier, so thank you for at least saying good morning to us. If you have a question, you could do that too. You could call us. 566-3909 is the number here to the station. And of course, we are streaming this live on Facebook and YouTube. It'll be on the radio later on this very day through our partners at KNMI 88.9. Shout out to them at noon. Every day we do this show, and then at KSJE, shout out to them at 5:06.
Shout out to us.
Yeah.
Yeah. I think it's worth
keeping
a
it
second
equal.
listen, personally.
I do too.
Might as well.
There are little nuggets that I miss sometimes that you
That
have.
I provide?
You
Yeah.
do.
Well, thank
that
you.
I get on the second,
Thank you,
second
yes.
airing.
Well,
Yeah. So
you know.
thank you. I appreciate that. Yeah. So
Cool.
anyways. We do have another interview.
Excellent.
So do you want to go to that?
Yeah, totally.
Okay. It's going to take me just a second to do that. Easier said than done.
Right.
But I can get there in a minute because we spoke with two doctors from San Juan Regional Medical Center.
Yes.
They
Dr.
are actually
Philpott and Dr. Greenberg.
They are actually busy right now, which is why we talked to them yesterday before they got busy when they had a little bit of time. And so we want to share that with our listeners right now. So we're ready to go. Joining us now to talk a little bit more about COVID-19, coronavirus, and the response here in San Juan County on the telephone. We are being joined by Dr. Aaron Philpott again, who is a hospitalist and chair of the Infection Control Committee at the hospital, and Dr. Brad Greenberg, emergency medicine technician and chair of the emergency management team at San Juan Regional. Good morning.
Good morning.
Thank you, doctors, for joining us. And let's start with, we're going to say we're talking on Wednesday. This interview is airing Thursday. So can you give us kind of an update of how things are today at the hospital? We've seen our cases are still increasing here in San Juan County and across the state. So how are things going at the hospital?
Well, at present, like you said, today is Wednesday. The number of cases in New Mexico is 315, and within San Juan County is 32. Currently, in our facility, we do have a handful of COVID-positive patients, 8 patients, and several of which are in the intensive care unit. And we're closely following these numbers over time, as well as closely following all those patients presenting with symptoms of influenza-like illness. To see if we're seeing in our inpatients and in our outpatient settings, like urgent cares and emergency departments, if we're seeing an increase in those numbers of patients presenting, seeking care. So we're fully engaged and aware of the local situation and trying to make sure that we're able to match our healthcare infrastructure resources to meet the demands of this unique pandemic.
And it definitely is unique. I hear what you're saying, definitely. And so Megan, I know you had a couple of questions for
I do
the
have
doctor, and I
yes.
will let you ask your questions.
Thank you.
Sure.
So it's my understanding that coronavirus has been around for quite some time, and so I want to take this opportunity to ask some actual scientific experts here. What happens? Like, how does this new strand come about, and what makes this strand different from all the other coronaviruses that I guess have been around for some time?
Yeah, that's a good question, Megan. Coronaviruses are a family of viruses. There's 4 very common human coronaviruses that are endemic globally and make up about 20% of respiratory tract infections in adults. These symptoms are generally mild and are just, your run-of-the-mill cold during cough and cold season. There have been a couple of, or now 3, sort of super coronaviruses. The first one came about during an outbreak in 2002 that started in China. It rapidly spread across the globe due to person-to-person transmission. It did have a significant, it caused a significant number of people to require ICU care. But it was rapidly contained, which was attributable to some really effective public health measures, and it's likely less transmissible than our current COVID-19. The next big sort of super coronavirus is the Middle East Respiratory Syndrome, or MERS is what it's commonly known as, and that was first identified in a Saudi man in 2012, and it kind of remains smoldering and sporadically spreading it intermittently still. So both SARS in 2002 and MERS had a higher mortality than our current COVID-19. But what can happen, so much like flu, you've likely heard of pandemic flu, is the virus can mutate in a way to be new enough that none of us have immunity against it. So our bodies are experiencing it as a whole new virus. And that is the reason it can cause more severe illness, because it takes time for our bodies to build up the immune-fighting cells, which will protect us from this in the future. So we are all susceptible. There's no concept of herd immunity to prevent us from passing it to person. And another kind of unique thing about COVID-19 is that it does spread fairly readily. They look at how easily it spreads. So for flu, for example, for every single person infected, they can spread it to 1 or 2 additional people. And the numbers with COVID-19 are telling us for every single person infected, in the absence of social or physical distancing, it can spread to 3 or 4 people. And as you can imagine, that just causes exponential spread and infection and growth of the virus throughout our community.
Interesting. And of course, that's the whole reasoning behind all these stay-at-home orders that we are seeing statewide and almost nationwide now, or at least in the region, to stop this spread.
And a follow-up question to that is, each day we're seeing more and more cases, at least we're tracking the San Juan County numbers, et cetera. And so currently, right, the curve is not flattening. And so my wondering is, there's only so long before I think your average public starts wondering, why are we doing this, right? We're not seeing any change. Why are we continuing to quarantine? Why are our business still shut down? And so, again, I know that there's no probably solid, firm answer on this, but maybe you can speak to those concerns when we're not seeing any decrease right now in numbers.
I think that's a good question. I think that there is some concern as we're seeing the numbers increase. Why do we do social distancing? Why are we changing our lifestyle right now in order to meet the challenges of what looks like an invisible hazard? And so I can understand the concern, but I think it's extra important at this time to really emphasize the importance of social distancing, the importance of really it's the physical distancing component of social distancing. I've also heard recently people are trying to talk less about how we're distant from each other socially, but more about how this represents physical distancing in order to minimize transmission of the virus. We can still remain connected in many different ways and still remain engaged also in the economy as well. That being said, it's important to understand the nature of what it means to flatten the curve and what the consequences of not flattening the curve actually are. Because the curves, and most folks are familiar with this graph, which describes one peak which goes above a certain line, a horizontal line, and then another bump which sort of goes along, but it stays below that horizontal line. And people have seen this graph, but really it's important to understand what that means. So the short peak, the one that's really, really tall, that represents, if we do nothing, that represents exponential growth, an overwhelming number of people getting this virus in a very short time frame. The other bump, or the smaller, or the shorter but more prolonged one, represents the same number of people getting the virus, but spread out over a much longer time frame. And the important thing is that how do those things interact with that horizontal line? That horizontal line is the hospitals and healthcare infrastructure ability to take care of people. Above that line, we're overwhelmed and the systems break down. And below the line, we're able to care for all the different needs that are associated with both COVID-19 as well as the other things that usually happen. And just because COVID-19 is happening doesn't mean there aren't going to be, say, car accidents or heart attacks or strokes or other sort of healthcare or medical-related emergencies. Those things still need to be dealt with. But if we're overwhelmed and we're unable to cope with a lot of these challenges, then we end up seeing people get sicker and more people dying from both COVID-19 and things that would otherwise represent preventable mortality. So I think that it's important to understand is that as we're not seeing, just because you can't see this thing, it doesn't mean that it means there's no value in this social or physical distancing. The physical distancing essentially helps all of us together prolong this enough where we don't break the hospital, where we don't break the healthcare infrastructure. And those are the things that will help keep people alive. And we all have to do this together. We all have to recognize that this is a challenge and that this is a hardship. But this is a hardship that we need to bear together as a community in order to make sure that we are able to navigate this event and come out on the other side having done the best that we could.
Understood. And doctors, I know we're kind of seeing examples of that, aren't we, in maybe Italy and in New York City and things like that? I mean, you two maybe get more information than I do, but you're on the front lines of this.
Yeah, that's exactly right, Scott. There are some very concerning stories coming out of some of these different places that are becoming overwhelmed. And I think we just cannot emphasize enough that though it is difficult for the public to see the fruits of their labors staying home, they are there. And it is essential now more than ever. And because we don't want to end up in a situation where we run out of ventilators or we don't have enough hospital staff to care for the folks who come in. Like, we want to support our community and are doing everything we can on our end to do it, and hope that everyone in the community is working just as hard to support this effort. And I think another important piece is how this lag, the incubation period for this virus is 2 to 14 days. It usually, the onset of symptoms is around 4 to 5 days after exposure, and then people generally are, feel ill, but not necessarily needing hospitalization until around day 7 or 8, so a week or so into their illness. So we're seeing kind of a lag in what's happening out there. So it's going to unfold over the next few weeks, and I think that's really important for people to be aware of, that even though every day doesn't seem significantly different, it is rapidly unfolding.
Well, we're definitely seeing the numbers going up, and again, that's concerning to I think Megan and I, and a lot of folks who are watching them. And as we mentioned on the program on Wednesday, that we're looking forward to the day when we look at those numbers of new cases maybe staying flat or decreasing, and the numbers of recoveries going up and things along that line. And Dr. Philpott, as you were saying, it's important to note, I think, that not everyone who is diagnosed as positive with COVID-19 requires hospitalization. It's very possible they could go home and self-isolate and treat their symptoms with over-the-counter medication or things like that and recover. Isn't that true, depending on the patient?
Yeah, that's exactly right, Scott. About 80% of people do just fine. They experience this virus on different levels of discomfort, but generally most people can stay home and manage with supportive measures and their usual cough and cold flu remedies.
And that helps, I guess, with patient numbers at the hospital too, then, right? If they're not taking up a bed at the hospital, you have more room for the more severely ill.
That is exactly right, and we are encouraging people to stay home if they don't feel they need medical attention, and to manage at home the best they can. And if they feel they need to be evaluated, if they're having shortness of breath, chest pain, and kind of all those things that would normally bring you to the emergency department, we're here for you. We're here for them.
Great. And one more follow-up question. Wondering if you could speak to repeated exposure. So we're hearing some stories about particularly younger, healthier physicians or healthcare workers coming down with some severe cases. Is this more a matter of the more that you're around this, the more likely you're going to experience it or catch it, or is this more related to there's an actual intensity, the more that you're exposed to it, the harsher it is on your body, if that makes sense?
Megan, if I could just make one other comment
Yes.
about this. I wanted to say, just before I answered this question and before Dr. Philpott answered this next question, I wanted to say that folks that are concerned, San Juan Regional Medical Center has stood up a COVID-19 screening telephone line that I'd like to mention. So if folks are concerned and they're wondering, should I go get tested? Should I go to a healthcare facility? Would it be okay to share that line?
Yes,
course.
please.
So that number is 505-675-4722. And right now, it looks like they're this week, beginning Wednesday through Friday from 8:30 until 12:30, and then expanding next week to be 8:30 until 4:30 p.m. Monday through Friday. So that starts on Monday, April the 6th, with the expanded hours.
And this will be answered by a medical professional, correct?
Yes, I believe that there are nurses who are going to be available to help folks navigate their concerns and match those concerns and what's going on with them with the right kind of resources. And sometimes that's reassurance, sometimes that's you need a test, and sometimes that may mean that they need to seek additional care.
Got it.
So in order to answer the next question, I think was a very good question. There's been a lot of concern about healthcare workers getting sick and what happens with repeated exposure. There are a lot of very good questions, but not a lot of very good answers for that. There is some questions about, does it matter is there an impact of the viral load or the intensity of the initial exposure, or does repeated exposures, or what is called, or what is sort of known as the inoculum effect, does that series of exposures increase someone's risk? And so anecdotally, there have been sort of sicker healthcare workers. Definitely in Italy, there have been a number of healthcare workers that have come down with the illness and died. And so it's definitely something that people are very concerned about. But I think at this point, there aren't a lot of great definitive answers as to why.
It's just so new and so different from what we've encountered before, I guess. Is that the idea?
Yeah, there's some pretty good theories about exactly the reasons why, but there hasn't been enough time and enough science behind it to really help us understand exactly the reasons why healthcare workers may get sick. That being said, we do everything that we can through the use of personal protective equipment to try to reduce those risks in a way that keeps the safety of the healthcare workers as our one of our real high priorities to make sure that we keep all of our folks safe.
Well, sure, and that kind of leads us into the next question here for both of you is using all that personal protective equipment, and I know the community has tried to step up to provide what you may be lacking or running short of or things like that. Can you give us any indications of supplies at San Juan Regional Medical Center? Or I know all of you are working probably longer hours and dealing with more patients and things like that during these days. Do you have the equipment that you need?
Well, I think that's another great question, and I think we followed this very closely. I think that at this time, what we've noticed is considerable tightening up in supply chains and real difficulty in trying to obtain the equipment that's needed. So that's why you've seen San Juan Regional Medical Center reach out to the community, and the community's been very responsive in trying to supplement the supplies that we have with those things that may exist already in the community. And so we continue to follow these things very closely. We've structured the way that we use that equipment in a much more defined way, and that means to say that we really have spelled out very clearly the kind of equipment that needs to be used in certain kinds of clinical settings.
Sure.
When we need to use the N95s that you hear so much about in the media, and when we can use simple surgical masks and the use of eye protection and gowns. We're really trying to formalize the process so we can use those things every time we need to, but we don't need to use those things when they're not necessary. And I think, but I think that the concerns about supply are real, and the concerns about this extending into the future, especially when we start talking about weeks to months and having an interrupted supply chain for that duration, we really are actively trying to work through all of those challenges.
Understood. Well, we are running short on time here, doctors, and I thank you both for joining us. I know the hospital is also, before we let you go, continuing its external assessment areas during the week, and that has proven to be helpful, I think, to try to let folks know if they're coming in with symptoms, correct? And that will continue again on Friday. Is that correct?
Correct. It's happening. So today's Wednesday, so it's happening today, and then it will happen from 10 a.m. to 2 p.m. on Friday. And also the telephone line that I mentioned just a second ago is going to be able to help people articulate with the external assessment site and hopefully in an attempt to reduce wait times and to make sure that those people are coming to the assessment site when they need to. So I think that should be very helpful, and we're going to try to continue to build these things to meet the needs of the residents of the Four Corners. And
again, that line, the number one more time, if you wouldn't mind repeating it, Doctor?
Absolutely. It's 505-675-4722.
Very good. Well, again, Dr. Greenberg, Dr. Philpott, we can't thank you enough for spending some time with us and, again, answering some of these questions and other questions that our viewers and listeners have as well. So thank you for joining us today.
Thanks for having us.
Thank you.
You're very welcome. Thank you both very much. From San Juan Regional Medical Center. Got your questions answered, Megan?
I did.
Paula?
Oh, okay. Man. I love it when we get to ask the docs whatever we've been ruminating on.
Exactly.
Yeah, because I feel like I just read all of this science, and some of it I know is a reputable source, but, it's just great to be able to double check.
Very true.
So.
Very true. Thank you again, doctors.
Yeah.
We're back in the studio to talk a little bit about the website where we are compiling the coronavirus, COVID-19 local stats for the community, ksje.com, everybody. So the latest numbers, again, we share these because we are awaiting for the day when they don't go up as much as they had been going up, that flattening of the curve.
We are awaiting that day.
So there you go. Statewide, 48 new cases from yesterday. Mm-hmm. So we're now at 363. San Juan County has 5 additional cases. That's 37 now. There was 1 additional death reported across New Mexico for a total of 6, and the number of recoveries stands at 26.
The recoveries seem to be flattening the curve.
They are flat at the moment.
Well, but also, for those of you who are just joining, I do want to reiterate Dr. Gensini's point, which was it used to be that the cases doubled every day, and now the cases are rising 3.2 days. Which I feel like,
there's more time between the doubling of the cases. That's what we're looking at. That's
right.
Mathematics.
Yeah, that is Mathematics.
Yes.
So anyway, just throwing out some positive things that we can hang on to.
Right.
That is a very important. The length of time between cases tells us something for
Right.
sure, and also just reiterating that there are some things we can do. So
Yes. Good
it's
point.
yeah, right. It's helpful to. We're not just sort of victims of this passively of this disease. It's doing its,
Right.
It's scary, but we have things we can do. So,
Right. And again, as we get more testing out, I think
Right.
that's the other reason for the increase
Yeah.
in cases is more people are being tested. There's more tests available. I think the governor's gone on record saying she'd like everybody in New Mexico to be tested, so that you would know,
Wow.
where the cases are concentrated and things like that. Because this
Wow.
virus, I know you didn't hear that.
Sorry, I did not.
Okay.
Yeah.
But because this virus, you could be infected and still not show symptoms,
Sure.
and that's the problem.
Carriers, yeah, sure.
Exactly. So if we test everybody,
Sure.
then we kind of know.
But what are the logistics of that? Like mailing
It's-
us, or
Well, it would be a lot.
it would? Yeah. I don't know. I don't know if Americans would do that, Scott.
I think the term is stay tuned, and we'll find out more
it's
about
very
that.
like fever clinic.
If and when the tests are available, but that was what she had mentioned. Anyway,
Interesting.
I want to show you
Okay.
some of the other
Sorry.
stories that
Yeah.
came in from the Navajo Nation. There's 40 more cases across the Navajo Nation from 24 hours ago for a total of 214. They have 7 deaths, and that's of course parts of Arizona, New Mexico, and Utah, and some of those numbers are included in the New Mexico numbers. So it's important to note that. One positive case added in La Plata County, so that's important to mention. Then, meantime, and we're going to work on this for getting some guests next week to talk about this new volunteer efforts and this new hotline with, so many involved with this. Salmon College, Salmon County, the City of Farmington, Salmon United Way.
Yeah.
Great organizational efforts there to put together this hotline for folks who want to volunteer in some capacity.
Right.
And it could be from your home or just doing some other work to help out
Right.
organizations that need it. And then this is the screening line that we talked about, that the doctors talked about today,
Yes.
which is now open, by the way, everyone, to answer your questions, staffed by one of their nurses.
Right. 505-675-4722, but it's also on our website. So
On the screen. And so, again, we've been compiling those stories on our website, kind of a one-stop shop for folks if you want to go and get local information. And again, we realize that the statewide media does a pretty good job of talking about statewide responses and information, but not a lot of sources for local information. That's why we're here.
that's why we're here.
There you go. That's true. All right, everybody. So final moments, if you want to call in and share something positive going on. We got a lot of great response about the bear hunt yesterday that we talked about.
Well,
People love that.
Thank goodness for that. Yeah.
Yeah,
Put
they
put your bear in the window and give the kids something to do.
Exactly.
For all of our sanity.
Be driving around and looking for the
Right.
bears.
I mean, hey, I love it. People are branching out, getting creative, and that's awesome.
It is.
So another positive note, I have a kiddo in the Farmington Municipal School system, so
Okay.
that's all I can speak to. But I'm sure that other districts are doing similarly well on this front. But schooling has been moved online, and I just have noticed that, and of course we don't want to generalize too much, but that the majority of the educators have really not just adapted so quickly to this, because I'm sure some used electronic communication more than others, but everybody has been forced into
They
that.
have to now,
They
right.
have to, and it very well could be way out of their comfort zone.
No
et
more
cetera.
sending notes home hoping they get there. Now it's all electronic.
I know. Whew. But anyway, so yeah, but I've also noticed that just they've gone above and beyond just the schooling piece, right? So there's tons of positive communication with students that are really checking in on the student as a person, not just as a student. And so they're going above and beyond the grading and the assignments and really trying to take care of all of the kids on a deeper level. So
That's great.
thank you, educators.
Shout out to all the teachers
Yes.
out there that are having to do
Thank
this
you.
and doing it. We've heard
And the tech guys that have probably gotten phone calls
That's
from
right.
people like me
probably
who don't know tech things.
that's true.
That's why I'm sitting on this side, listener.
you are
And
away
he's-
from all the buttons.
Yes.
Yeah, that's how it works.
I will
But
abuse the button privilege.
It's worked out pretty well.
Yes.
I think so. There you go. All right, everybody.
Cool.
We appreciate you joining us again for our daily update program, Monday through Thursday at 9 a.m. Again, streaming live on KSJE, and then they'll be airing again over the radio, KNMI at noon at 88.9 and KSJE at 5:06 p.m. We will see you on Monday, everyone. Stay safe and stay home.